Thank you for inviting me to speak with you during today's virtual rally for medical research. I'm honored to address all of you, and I thank you for speaking with one voice on the need to increase investment in medical research and, of course, to save lives. Thank you to the more than 350 organizations that are taking part in today's event. I know it's not the same being together, but we find ways to get things done. And I think that's what this is about today. Since 2013, you have brought hundreds of patients, family members, survivors, researchers, and healthcare professionals from across the country to Capitol Hill, all advocating to increase funding for NIH. As we all know, the NIH plays a vital role in supporting cutting-edge research to help prevent and treat some of the most debilitating conditions. And it has helped our country to lead the world in biomedical research and innovation. It's helped with jobs. It's helped with the economy. Medical innovation may not be uniquely American, but it is something that has always set our country apart. We're the country that led the international effort to map the human genome, helped discover the structure of DNA, and brought the world everything from medical gloves to electronic hearing aids to adhesive bandages. And today, as we are facing a global pandemic, we need medical research and innovation more than ever. My husband John recovered from COVID earlier this year. He was really sick. He was in the hospital for a week with severe pneumonia. My dad then got it at age 92 and survived and actually had less symptoms from it. And it made me really understand just how unpredictable and devastating this disease can be. My husband actually became the 7th person to donate plasma to the Mayo Clinic as part of Mayo's program to determine whether antibodies from recovered coronavirus patients can help us in the fight against this public health crisis. Research like this has never been more important, and the NIH is the largest source for medical research funding in the world. That's why we need to continue to boost funding for the NIH. And obviously, yes, it's about COVID, but it's not only about COVID. And I am hopeful that maybe all this research that's suddenly being done will somehow help us get to the bottom of other diseases as we continue to research those diseases. I'm proud of the work that we have done year after year to make sure the funding is there for the NIH, and I believe we even need to do more. These annual NIH increases have been long overdue. Before the 21st Century Cures Act was signed into law in 2016, an important milestone for increasing NIH's funding and making sure that patients' experiences are considered in the drug approval process. And by the way, I was proud to be there when the Cures Act was signed into law by President Obama. We know that NIH funding was flat before that for more than a decade. That's why I remain committed to ensuring that medical research continues to be prioritized. And I work across the aisle because members of both parties know how important this research is and how many families are counting on it. And they know it because of the work you do. They have people in every state that come talk to them. You have talked to so many members of Congress, either over the phone now or by email, yes, or by Zoom. But in the past, you went to Washington and then you showed up at congressional meetings and other things in people's districts. These are challenging times. And today's theme, more progress, more hope, and more lives saved, is a message that has never been more important. So keep up the good work. Tell your stories and continue making your voices heard. Thank you.